An estimated 10 to 20% of people aged 65 or older with MCI or mild cognitive impairment develop dementia over a 1 year period. Now, if you don't know what dementia is, it is a condition in which you lose your cognitive functioning, for example, thinking, remembering, and reasoning, to such an extent that it directly affects your life and daily activities. What is mild cognitive impairment? Mild cognitive impairment or MCI is a condition in which a person loses cognitive abilities on a smaller scale and symptoms are not severe enough to directly affect your day-to-day life. This minor decline in abilities is noticeable by the person facing this condition or by people who interact with that person regularly. It is estimated that between 5 and 20% of people aged over 65 have MCI. Although MCI is not a type of dementia, those who have it are more likely to develop dementia later in life. MCI can develop for multiple reasons. The risk of developing mild cognitive impairment increases with age, and conditions like depression, stroke, and diabetes may also contribute to the development of MCI. What is the difference between mild cognitive impairment and decline due to normal aging? A gradual decline in cognitive abilities is also seen as a person gets older. For example, the ability to learn new information may reduce, and the speed of processing information may also decrease with age. However, this decline in abilities due to normal aging does not affect a person's daily life that much. In the case of normal aging, a person may occasionally forget names, fumble upon words or misplace things, but this does not happen as often as in the case of a person experiencing MCI. A person with MCI frequently forgets information that an ordinary person would not do. Symptoms of mild cognitive impairment. Mild cognitive impairment is classified by experts according to the thinking skills that are affected. MCI that predominantly affects memory is known as amnestic MCI. A person may start to forget crucial information, such as appointments, conversations, or recent events that he or she would normally recall without any effort. MCI that affects thinking abilities other than memory is known as non-amnestic MCI. Now, what are the thinking abilities other than memory? That are decision making, estimating the time or sequence of steps required to perform a complicated task, or visual perception. Attention lost is also a major symptom of MCI. Focus is lost and a person is vulnerable to becoming distracted. Now, what causes mild cognitive impairment? There are a lot of factors that can contribute to the development of mild cognitive impairment. Some of the causes of mild cognitive impairment include depression, stress and anxiety, thyroid, kidney or liver problems, sleep disorders, conditions like stroke or diabetes, conditions that affect blood flow in the brain, low vitamin B12 levels or other nutrient levels, side effects of certain prescription or illegal drugs, history of alcoholism. Genetic factors may also play a major role in who develops MCI. Researchers are trying to figure out why some people with MCI get other diseases while some people do not. Treatment for mild cognitive impairment. The American Academy of Neurology recently published a review of studies on mild cognitive impairment that concluded that medications used to treat Alzheimer's disease had no cognitive improvement or slowed the progression of mild cognitive impairment to dementia. So there are presently no medications approved to treat mild cognitive impairment. And that's it for this video. If this video was helpful, then please subscribe to the channel and turn on the bell notifications if you want to watch more videos like this.